Today is our topic is the mastoid surgery. Terminology: the operation performed the chronic ear infection. First, myringoplasty. In myringoplasty, only repair of the tympanic membrane. This is the reconstructive procedure. And second is tympanoplasty without mastoidectomy. Tympanoplasty means myringoplasty मतलब tympanic membrane repair and the ear ossicle repair. We eradicate the disease of the middle ear and reconstruct the hearing without the mastoid surgery. Okay. Tympanoplasty with mastoidectomy. In tympanoplasty, we first eradicate the disease both from the mastoid and the middle ear cavity, and also reconstructed the hearing mechanisms with or without the tympanic membrane grafting. This is the tympanoplasty or mastoidectomy. Cortical mastoidectomy, simple mastoidectomy, and Schwartz operation. What is the cortical, simple, or Schwartz? In this, excentrations of the all accessible mastoid air cells preserving the posterior meatal wall of the middle ear cavity. And MRM modified radical mastoidectomy. It is operation to eradicate the disease from the attic and mastoid, both of the which are the exteriorized the external auditory canals and removal of the posterior meatal wall and lateral attic walls. Tympanic membrane remnants, functional ossicles, and the reversible mucosa functions. The eustachian tube are the preserved. Here are the time the surgery second stage operation we can do. In radical mastectomy, what is a radical mastectomy? It is an operation eradicate the disease of the middle ear mastoid, in which the mastoid middle ear cells and attic and antrum are the exteriorized in the external aortic canal by removal the posterior meatal wall. All the remnants of the tympanic membrane, malleus, incus, a coda tympani, and mucoperiosteal lining are the removed. Note the stapes. An opening of the eustachian tube is closed by packing the piece of the muscle or cartilage into the eustachian tube. It is the radical mastoidectomy. Meatoplasty. What is the meatoplasty? Meatoplasty is the operation in which the crescent of the conchal cartilage is excised. Conchal cartilage को हटाया जाता है to widen the meatus. meatus को वाइड करते हैं. It is invariably combined with the all canal wall down प्रोसीजर. एमआरएम या रेडिकल मेस्टोडोमी, जिसमें भी कैनाल वॉल डाउन किया जाता है, एमआरएम और रेडिकल मेस्टोडोमी में उसके अंदर मीटोप्लास्टी किया जाता है ताकि ड्रेनेज हो सके, क्लीनिंग कर सके, बार बार में इंस्पेक्शन कर सके. एंड mastoid obliteration. It is operation to eradicate the mastoid disease. When present, the obliterate the mastoid cavity. Obliteration mastoid cavity is done with pedicle temporalis fascia and musculofacial tissue is raised is flap. What is the approaches? Endomeatal or transcanal approach. Endomeatal or transcanal. It is used to raise the tympanomeatal flap, the middle ear. Rosen's incision. It is most commonly used for the stapedectomy. It requires the meatus and canal to wide the enough to work. Two parts occurs. First is a small vertical incision at the 12 o'clock near the annulus and curvilinear incision at the 6 o'clock. 6 o'clock और 12 o'clock 12 o'clock पर इंसिजन लगाया जाता है पोजिशन टू मीट द वन इंसिजन. दोनों को मिला दिया जाता है ऑन द पोस्टीरियर रीजन ऑफ द कैनाल के पीछे की तरफ, पोस्टीरियर और सुपीरियर था 12 o'clock और 6 o'clock पर. एंड 5 mm अवे फ्रॉम द एनुलस से 5 mm दूर पर. पोस्टीरियर मीटल कैनाल स्किन इज रेज्ड. पोस्टीरियर मीटल कैनाल को रेज किया जाता है कंटिन्यूटी विद द टिम्पैनिक मेम्ब्रेन के साथ में एंड डिस्क्लोजिंग द एनुलस को हटाया जाता है फ्रॉम द सल्कस एंड द गुड व्यू द मिडिल ईयर एंड ओसिकल्स देखा जाता है. स्टेप इज इफ स्टिल कवर्ड बाय द पोस्टीरियर सुपीरियर ओवरहैंग बाय द बोनी मीटर, इट इज एक्सपोज्ड बाय द रिमूविंग द पार्ट ऑफ द ओवरहैंग and this incision is also used for the exploratory tympanotomy to cause the conductive hearing loss or inlay myringoplasty or ossicular reconstruction. This is the end oral or transcanal procedure. And end oral, second is end oral procedure approach. Excision of the ostium, end oral exostosis, large tympanic membrane perforation, attic cholesteatoma limited extension, MRM, where the disease is limited in the atic antrum or only part of the mastoid. And oral approach is through the Lampert incision. It consists two parts. First is the semicircular incision made 12 o'clock to 6 o'clock and posterior wall and bony cartilaginous junctions. Second, the Lampert second is the first incision 12 o'clock and passes upward curving linear fashion between the tragus and crus of the helix. And its parts, the incisura terminalis, thus doesn't cut the cartilage. Both mastoid and external canal surgery can be done by the Lampert incisions. Postoral incision या Wilde incisions. It starts from the highest attachment of the pinna, and follows the curve the retroauricular groove 1 centimeter behind and ends of the tip of the mastoid tip. In infants up to the 12 year of the mastoid doesn't developed and the facial nerves lies near the its exit. Incision therefore slanting posteriorly, avoiding the lower part of the mastoid. And postural incision in the sulcus retroauricular. Postural incision is used for the cortical mastoidectomy, MRM, radical mastoidectomy, tympanoplasty, or exposure of the seventh nerve in vertical segments in facial paralysis or any trauma, or endolymphatic sac decompression in the Meniere's disease also. And cortical mastectomy known as the simple complete mastectomy, Schwartz operation, a complete extract all accessible mastoid cells, converting them into the single cavity posterior wall left intact. Medial structure is the not disturbed. Indications: acute coalescent mastoiditis, masked mastoiditis, incomplete removal of the acute otitis media or reservoir sign may be present. Fourth initial step, perform the endolymphatic sac surgery, decompression of the facial nerve, translabyrinthine or retrolabyrinthine procedure of the acoustic neuroma. This is the retrocochlear disease. Anesthesia is the general anesthesia, also maybe in the local anesthesia. Position is the turn face one side where we are doing the ear is uppermost. Step of the operation: first incision, curvy linear posterior incision 1 centimeter behind and parallel to the retroauricular sulcus. Starting at the highest attachments of the pinna to the mastoid tip. In infants up to the 2 years, short and horizontal incision to avoid the cutting the facial nerve at the lower part of the mastoid. And incision cut soft tissue to the periosteum temporalis muscles not to be cut in the incision. Second, exposure of the lateral surface of the mastoid and Mekian's triangle. Periosteum is incised in the line of the first incision. The horizontal incision is made along the lower border of the temporalis fascia for the more exposure. Periosteum is scraped from the surface of the mastoid and posterior margin of the osseous meatus and tendinous fibrous is the mastoid are the sharply cut and down. Then self-returning mastoidectomy applied because our both hands are the now free. Third, removal of the mastoid cortex or exposure of the antrum. Mastoid cortex is removed with cutting bar or chisel hammer or gauze, but this is now excluded. Mastoid antrum is exposed in the area supramitral triangles or Mekian's triangle. In adults, antrum lies 12 to 15 mm या 1.5 centimeter from the surface. Horizontal semicircular canal is also identified. Removal of the mastoid hair cell. All accessory mastoid hair cells are removed and leaving behind the bony plate of the tegment tympani and sinus plates behind the posterior medial wall in front. Removal of the mastoid tip, finishing the cavity. Lateral wall of the mastoid tip is removed and exposing the muscle fibers posteriorly of the digastric zygomatic cells is situated root of the zygoma. Retrosinus cells lying between the sinus plates or corticals behind the sinus are the removed. A finishing cavity have beveled edge Soft tissue can be easily sit and obliterated the cavity. Closure of the window. Mastoid cavity is thoroughly irrigated with saline to remove the bone dust, and wound is closed in the two layer, and rubber drain may be left at the lower end of the incision for 1 to 2 days or 24 to 48 hours in case of the infection or excessive bleeding only. Metal packs should be kept in avoid the stenosis of the ear canal and mastoid dressing applied. Post-operative care, we should use the antibiotic post-operatively or post-operative both. Drain removed after 48 hours. Stitches cut out the 7th or 6th days. What is the complication of the mastoid surgery? First is the facial nerve injury, incus dislocations, horizontal semicircular canal injury. Horizontal semicircular canal causes the giddiness and nystagmus, and sigmoid sinus injury causes the profuse bleeding. Dura in the middle cranial fossa also export, causing the bleeding. Post-operative wound infection or wound breakage downs occur in the is the all the complication. Thanks.